So I've got 3 questions for you, and my inference is that you won't be able to answer yes to these 3 questions. Or maybe you might answer yes to 1, maybe 2, but I'm inferring that you're not going to answer yes to all 3 of these. And that is a problem, but it's not your fault. And at the end of the video, I'm going to talk about why it's a problem and why it's not your fault, but what you can do to start solving this problem. Because this is one of the things that I alluded to on the video down there that drives me crazy when patients come in and they've already been giving a diagnosis and they think that they are their diagnosis. And they want to know from me, how am I going to help them feel better even though they have this diagnosis? Okay, so here's the 3 questions. See if you can answer yes to these 3 questions. Number 1 question. When you are doing an evaluation with a patient, are you avoiding giving them a diagnosis? Is it not even coming across your mind that you need to give this patient a diagnosis? Question number 1. Question number 2, during the first treatment after you've done this evaluation with the patient, are you spending the overwhelming majority of your time assessing and treating away from the body part that has such referred diagnosis? So let's say if they've been referred for a subacromial impingement or a patellofemoral issue, are you spending the majority of your time not at the shoulder and not at the patellofemoral joint? Number 3, are you relating your treatment and your patient education and the things that you're going to give them from home exercise to the root cause of the diagnosis or the root cause of the symptoms? So they've been referred to you for plantar fasciitis. Symptoms are foot pain. Are the things that you're talking about with them away from the foot? Are they more microscopic and on a physiological level than pain and swelling? So we know that from, I believe it was on day 2 of the challenge, that the progression to injury, that symptoms, pain, swelling, loss of range of motion, tightness, all that kind of stuff is the very end. Are you rather than spending your time there, are you spending your time at the root cause, getting rid of that, and just ignoring the actual symptoms with your treatment, their home exercise program, and their patient education? So could you, or did you, answer yes to all 3 of those? Odds are you didn't. That's a problem. And the reason why that's a problem is because when you give a patient a diagnosis, they believe that they have some kind of affliction that is a problem that they're going to have to structure their life around. They're going to have to wear orthotics because they have plantar fasciitis. They're going to have to avoid overhead repetitive reaching because they have subacromial impingement. They're going to have to never bend over at their back again because they have a herniated lumbar disc. Okay? So when patients come in to see me and I say, my first question to every patient that comes in, as soon as they sit down, I say, tell me what's up. And when they tell me what their diagnosis is, I know we have a problem. So when I say what's up and they say, oh, I have sciatica. It's not what I asked you. Okay. I asked them what was up, what's going on. Tell me, what your issue is. I have sciatica doesn't tell me anything other than you either saw a physician or a chiropractor or a physical therapist, or you went and Googled butt pain and it popped up with sciatica. So now I have to get that crap out of their head because sciatica doesn't cause sciatica. I'm not going to treat sciatica. And the odds that they have sciatica right now are minimal. Okay. So if somebody goes to see their physician after they flew on a plane for 5 hours and their butt got numb and their hamstring was tight and sore and they got off the plane, and that was a week ago, and since then they've had a little butt tightness, that kind of stuff, they go to the doctor, tell him, well, the doctor then says, oh, well, you have sciatica. No. What they actually had was sciatic type symptoms during a snapshot of a spot in time when they were doing something that could elicit symptoms that could be related to sciatica or similar to sciatica. That doesn't mean for the last week that they've had sciatica. Okay? So just because somebody has symptoms at a snapshot in time does not mean they have some kind of affliction that they're going to have to deal with or work their life around. What we need to figure out is what position were they in? Why did those symptoms happen? What's responsible for keeping those symptoms from happening? Why didn't that thing work? What am I going to do to get that thing to work to make sure that they don't have another snapshot in time where they have these symptoms that are termed sciatica? Okay, so just because somebody has low back pain and they go see their doctor and their doctor has no thought process, has no critical thinking skills, does not know how to do an orthopedic evaluation. So the only thing they know how to do is, let's get imaging. Oh, you're 60 and you have low back pain for a week. Well, look at this on your MRI. You have a slightly herniated disc and you have lumbar degeneration. That's what's causing your problem. No, they've had those things for years on top of years. They just had low back pain recently because they did something changed. They have inhibition now of something. It's up to some kind of medical professional, obviously not the primary care physician, obviously not the orthopedist, because they don't take time to actually evaluate and assess anybody. So that falls on you. So you need to be doing that. So instead of telling people and taking out the handout for herniated disc exercises, sciatica stretches, plantar fasciitis exercises, instead of doing that, what you should be doing is individually assessing the person in front of you, never giving them a diagnosis, going on with patient education about this is the root cause, this is why you had those symptoms at that time. If those symptoms come back, you're going to do these things that I'm going to give you, which will help reverse the cause of the symptoms because you don't have a disease or affliction or diagnosis. And I'm not going to work on that part that's over here that's got pain and swelling, because it's this stuff over here that's dysfunctional, that's putting too much stress on that over there, which is symptomatic. So if you would have learned how to put that thought process together in school, and if they taught you how to apply neuromuscular physiology and biomechanics and anatomy all together, so you're doing all this together in a smooth, systematic process, then you wouldn't be diagnosing people, you wouldn't be treating symptoms, and what was the third one? You wouldn't be doing what you would be able to answer yes to those three questions. So no diagnosis, I'm not treating the symptoms, and yes, I'm getting to the root cause, which is probably nowhere near where your symptoms are. Okay, so when patients come in and they tell you they have a diagnosis, you should be telling them, no, this is what's causing the symptom that sounds like it would fit with that diagnosis, even if they do have a herniated disc. So if this patient has a herniated disc, she's had low back pain for a week, she's 60 years old, she didn't herniate a disc a week ago, she's had that. Why is it happening now? That's what you need to educate them about. Okay? So stop giving diagnosis. That will also, so if you're not assessing symptoms, then that will help you not go to a diagnosis. That will help you not give them protocols and symptom modification. So if you are doing special tests and you are looking at imaging and you are taking a pain scale and all that stuff and taking a half an hour to do the subjective and the eval, then you have no choice but to give them a diagnosis and then chase symptoms and then have them chase symptoms on their own, which is unfortunate. When you're ready to stop doing all that stuff, when you're ready to tell people they don't have this problem that they've been told, to stop listening to what the physician told them, to get offline, don't read that stuff online and ignore their imaging. I am an expert. I know how to apply all of these thought processes to help you get to the root cause and eliminate what's causing the symptoms. When you're ready to do that, get in the shift, and that's what you will learn.